Hello, I'm Dr. Samantha. I'm a naturopathic doctor that specializes in hormone health and fertility care. And today we are going to talk about signs and symptoms of ovulation. Hello. So welcome back to another video. I'm so excited to talk about signs and symptoms of ovulation. Today it's going to be nice, short, and sweet, but I feel like this is going to be really valuable information for you all. If you have any questions at any point, please don't forget to write them down. I would love to answer them either via commenting back to you or through a video. Without further ado, let's talk about it. So I talk a lot about ovulation and timing in a lot of other videos. I have free guides on how to track ovulation. Again, we'll link that in the description below. So we track through basal body temperature. Temperature increases after ovulation due to progesterone, a hormone that is secreted by the corpus luteum, which is only created after an egg is ovulated from our ovaries. And that tells us like, yay, we ovulated, cool. You can also get a serum blood test that tests for progesterone values. Doctor can review with them and also tell you that you ovulated. You can actually also even get a ultrasound during the time that is predicted for ovulation, and they can tell you if you're getting ready to ovulate or if you've ovulated and so on. So there's a lot of ways you can tell if you ovulated, but what are signs and symptoms? Number one, your temperature increases. I already said that. I know I said we'll talk about ones other than that. Don't worry, we'll get to them, but it is a sign and symptom. So taking your basal body temperature is going to be really important in understanding that you did ovulate. So it's something that happens after ovulation occurs, but it is still a sign and symptom that proves that you did ovulate. Other signs and symptoms that I'm going to talk about don't necessarily prove ovulation, but they can make a really strong case that you have. So everyone's signs and symptoms are going to vary greatly. Some people have all the signs and symptoms, some people have none of them. Not everyone has all of these, and if you don't have them, don't worry. If you have all of them, that's okay too. We talked about basal body temperature. As I said, that was number one, but like I said, that proves that we ovulated, so it's something that happens. But what is something that's happening when your body's getting ready to ovulate, or what are you feeling during ovulation day? So some people will feel a little ping on either side of their abdomen. Technically, you only ovulate from one ovary, and a lot of times it switches off from which ovary you ovulate from. Sometimes it's a little ping, sometimes it's a pretty big ping. I'm saying the word ping, everyone experiences a different pain sensation. That's just a word I hear used a lot to describe that pain. People also experience breast tenderness, bloating, sometimes headaches. If you are getting headaches though, I would strongly encourage that you get your hormones worked up and evaluated. You might just have a hormonal imbalance. There's going to be cervical mucus change. So before you ovulate, there's going to be a little bit more like whitish, yellowish mucus. Not too yellow though, like more like a cream color, I should specify. And then maybe 2 to 3 days before ovulation, it gets a little bit more egg white-like, very slippery, clear. That's definitely a good sign. I know earlier I said that everyone's gonna have different symptoms. Some can have none, some can have some. That actually is one that I think we really want to have because that's going to help the sperm swim to the egg. So make sure you do have cervical mucus. Again, if you don't, maybe get some things checked out and evaluated. Some people do report some spotting during ovulation or on ovulation day. That can be your normal, and that might be totally fine as long as you're not bleeding for like 2 weeks until your period after. It should only happen like really on ovulation day, maybe the day after. There also may be some nausea as well as bowel movements changing. Now that again doesn't happen for everyone, and some people it could be totally normal, but some people might need their GI health evaluated, so that's something to think about. And last but not least, increase in libido. That one just makes sense, right? We're ovulating, our body's saying this is the best time to create a baby, so it's going to have us have an increased sex drive. Ultimately, again, this video is a nice, short, and sweet one today, but I hope you learned something new. If you did, please give this video a thumbs up. Please hit that subscribe button and turn on those notifications. We do come out with a new video every single Friday, and have a beautiful rest of your day.